Dr. Jeremy Faust teaches at Harvard Medical School and sees patients in Boston's Brigham and Women's Hospital. He's taking a break from the front lines to join us live once again tonight. Dr. Faust, it is good to see you again. I suppose you're not surprised at all by this news to close public and private schools for the rest of the year.
I'm not surprised at all. I think that the mayor here has been very data-driven, and the data changes and we change our policy. And so that makes sense right now. We need to move forward when it's safe to do so. We are all eager to resume life as we used to know it, but I think that no one would like to do that if, in exchange, you saw a burden of disease that tore through our cities like New York saw. We don't want to have that happen here. We've had it bad enough.
We said that you're taking a break from the front lines tonight, but take us to the front lines once again, if you could. How are things at your hospital?
Well, we're well-resourced here in Boston in general, but we're day-to-day. And so right now what I could say is, for example, our intensive care units are at 70% capacity, but that's in the context of expanded capacity. We got ahead of this, saw it coming, expanded the capacity, and even now we would be over if we didn't expand. When I see patients today and they come in and they come in and they come in, I'm blown away by how prevalent this disease is in our communities. And now that it's been in Boston for weeks, not days, we are seeing what we expect, which is the cases become more and more severe because the virus takes a little time to do its work, so to speak. And so I've been in the situation where I'm glad to be able to do it, but I'm having to save more lives, more direct intubations, more things that really require critical care. So we're seeing that even though the number of new cases has leveled off just slightly.
New York appears to be peaking, Dr. Faust. Do you have an idea when you think Massachusetts may?
Well, we know that over the past several days, new cases have come down consistently, but what we don't know is that because we are missing new cases because of inadequate testing? We're doing a decent job here, but the problem with talking about peaks is that kind of presupposes that this has a shape that if only we could just jump ahead and look at it, we could see it in the rearview mirror. We actually can change the peak. If we all of a sudden went back to life as we knew it before, we'd have a peak right away or very soon after. So I can't say when, but what I can say is that I think that we flattened the curve to some extent, and we need to stay the course to make sure that we don't get a huge spike down the road here.
You've been outspoken against hydroxychloroquine and azithromycin. Tonight, the NIH study that I mentioned earlier with Dr. Gottlieb recommending, or at least showing that it doesn't work as some thought, and in fact could be dangerous. Your reaction to that news this evening?
Well, what I wouldn't say I'm against these treatments. What I would say is I'm in favor of science proving whether they work or they don't work. And getting ahead of that without the science is the most important thing that everybody should be looking for. Hope is not enough. You need data. And what we have a piece of data now from the Veterans Administration hospitals that are showing us that, well, it's hard to 100% interpret that to say it doesn't work. What I would say is it doesn't look like the miracle cure that was marketed to us by the White House, and that's not surprising. And it looks like there are cardiac side effects that are real. So we still need to have a trial, a randomized controlled trial with a placebo and a drug, and see how that works, because then you'll find out if there are any people who benefit from it at all, or if it just hurts everybody. And that's where we're at right now, is that we're beginning to see that when you do science correctly, that you have the opportunity to keep everybody safe and hopefully find a benefit. But if you don't, you can't make it up. You can't pretend like you are.